Welcome to this edition of Labor Vision. I'm Bob Delaney, Executive Director of the Institute for Labor Studies and Research. Labor Vision, a production of the Institute, focuses on topics of importance to working Rhode Islanders. We hope you enjoy this edition.
Collected thousands, I think I was told this morning, 60,000 products during their first annual menstrual products drive. So that's an amazing effort run over the last few months, and we're going to hear more about it shortly. So these items will be distributed through our network of about 158 member agencies across the state, which include food pantries, meal sites, shelters, and of course women's shelters. And we really appreciate all the hard work by members of the Rhode Island Coalition of Labor Union Women with the support of the Rhode Island Federation of Teachers and Health Professionals, Teamsters Local 251, and the Rhode Island AFL-CIO in organizing the campaign. Here at the food bank, we know that many children and adults lack regular access to healthy, nutritious food. Without those meals, they may miss out on many activities that we all take for granted. The same is true of menstrual products. Without them, young girls miss school and women miss work. That is why it is so critical that these products be made available for free so that people have the products they need. So thanks to the success of this drive, we'll be able to ensure that more women and girls in our network will have access to the resources they need. And now I'd like to introduce Maureen Martin of the Rhode Island Coalition of Labor Union Women, the president, to tell us more about how they did it and how they organized the drive. Thank you.
Very much. So thank you all for coming, first off. Really appreciate you taking the time for this. I am kind of a little, not choked up, not there yet, but I haven't seen it all at once like this yet, so this is really great. So I am the Secretary-Treasurer of the Rhode Island AFL-CIO and sit as chair for the Coalition of Labor Union Women, who thought it would be a great idea to help some women out. So help a sister out, as we like to say. And came up with this idea of menstrual period products that we understood that there were women who didn't go to work because even even women who have jobs who are low-wage workers cannot afford the products they need if it comes upon you suddenly. And so we did a little research and found out that sure enough, not just in this country, but even worse in many other countries, girls miss school and girls and women miss school and work. And we thought this would be a great project. We took on, first of all, all the CLUW sisters and brother here maybe raise their hands, and this is our crew who's been working on everything for the last 4 months very diligently. So when we first started the project, we were very single-minded. We said, we just want to gather as many products as we possibly can to help as many girls and women as we possibly can. And so with that, we did what labor union women do. We organized ourselves. And then we organized a campaign. And we developed a flyer. We got a GoFundMe page. We reached out to people individually. We developed these boxes, which we're going to copyright, I think. They're pretty clever. We got these boxes and spread them all around the state of Rhode Island at union offices, at our book clubs, at women's groups, at businesses. I particularly want to thank Sarah Markey for all the collections she did down at her business, The Collective in Peacedale, which is kind of a bookstore meeting place for the community. And for the entire 4 months, she had boxes down there collecting. And it's places like that that really kind of built up what we did. Lisa's right. We had collected, I think we sent out a press release on Thursday or Friday and said we collected $50,000. So big news. Over the weekend, we jumped that up to 62,000 pieces of product. And even this morning I woke up to a message at 3 o'clock in the morning on my phone to say somebody had donated $50 on the GoFundMe page. So it's going to be never ending, I believe. But I want to tell you something. As single-minded as we were about what we were going to do, something happened while we were running the campaign. So when you run a campaign, and some of you have been involved in them before, you have to talk to people. Just like a political campaign, you have to go door knocking and talk to people and kind of sell your product. And that's what we were doing with Help a Sister Out, period. So everywhere we went, we talked to people about it. And the surprising thing was how little people, women and men, understood that there was even an issue about this. They didn't understand about the poverty of it, how living in menstrual poverty is just like another whole layer of shame over living in poverty. Although it shouldn't be shameful, there should be no shame in the game. If you live in poverty, I'm sure you didn't choose to do that, it's just your circumstances. So just like having your period, it's not something you choose to do. Those of us in the room who have had the pleasure know it's not something you choose to do, it's just part of what happens. And so we had a lot of conversations, hundreds and hundreds of conversations with men and women about what this is all about. And they asked a lot of really great questions, like, why do they tax this like it's a luxury product? So we're working on that here in Rhode Island, as they are nationally. I think maybe in the last couple of years, 11 different states have changed their laws on taxing menstrual products. They want to know why Medicaid or healthcare didn't cover these products that were so necessary. They wanted to know why there was such a lack of accessibility in schools and in our public buildings, whether they were free or not. There's just a lack of accessibility. Frank Flynn, who is president of the Rhode Island Federation of Teachers, I think I was remiss in thanking our partners, the Federation and Frank, who not only let us store all our products at their office, but also was our major donor to the campaign. And Teamsters Local 251, who trucked everything for us and was a huge donor, and we appreciate the help of our partners.
Thank you, Maureen. So I think we owe a great debt of gratitude to Maureen for spearheading this really important initiative, and for all of her CLUW colleagues who've done a great job over the past several months. And as Maureen alluded to, there was a lot of uncomfort in some of the AFL-CIO meetings when this topic first came up. So I think she's done a great deal to break down those barriers and, and have men like myself have these conversations, act like adults. And so I give her a lot of credit for that as well. And I want to thank Matt Tabey and the Teamsters. And this it also brought a number of different labor unions together, which is very important because, we all know that we're better when we're working together than we are when we're doing things individually. Our colleagues from the IBW, the NEA, the UFCW, and as I said, the Teamsters all getting together, and I hope I didn't miss anyone here, and the Institute for Labor Studies and Research, and the AFL-CIO parent organization under the leadership of George and Maureen. So it's been a great opportunity. We all know that one of the most important factors for success, both in our schools and in the workplace, is good attendance. And we also know that despite the growing economy that we have right now, there are many Rhode Island families that are still struggling in the areas of transportation, of housing, of food and utilities. And this, thanks to Maureen's work, takes one more thing off the table that people don't have to worry about, one more barrier that would keep them from being productive and leading productive lives. So thousands of people, thousands of women and girls will benefit from this great initiative. So that's really important work that you're doing, Maureen, and we really thank you for leading this. And on behalf of the Rhode Island Federation of Teachers, I hope this becomes a very sustained initiative that we can come back here and double the numbers on an annual basis. But giving credit to Maureen, it was her brainchild, and we really appreciate it, and we hope to continue doing this. And thank you all for your donations and your generosity, and both your time and your financial resources.
Thank you, Frank. Really appreciate those words. And it sounded like he challenged us to double this next year. Because I want to say this, so we have 62,000 individual pieces here, which means we can supply over 2,500 women for a month. So next we're going to hear from Kate Brewster, who's a board member here at the food bank, and who currently is the executive director at the Jonnycake Center in Peacedale, down in my area, and was previously kind of led the Poverty Institute, now called the Economic Policy Institute, thank you. And she knows a little bit about poverty, I would say, and she's going to talk to us about how this is affecting folks.
Good morning, everyone, and thank you, Lisa, Frank, and especially Maureen and the coalition, the Rhode Island Coalition of Labor Union Women, and everyone who participated in this event. Just quickly, the Jonnycake Center is one of the member agencies of the food bank. We serve the towns of South Kingstown and Narragansett. We have approximately 2,000 people a year that we see and help in some way, so this is really important. We know that poverty comes in many different forms, and sometimes we don't realize how people are affected by it. At the Jonnycake Center, as I mentioned, we offer South County residents who are struggling the resources that they need to improve their quality of life. For low-wage working women and women living in poverty, the inability to access menstrual products can marginalize them and put them at risk for preventable health complications. We distribute these products to women through our food pantry and to teens through our Johnny's Locker program, which provides high school students with toiletries, snacks, and hygiene items that their families may not be able to afford. This project is so important because this is an unspoken but critically important need for women, yet not something that people are likely to donate or that women are likely to ask help for or help with. So I want to thank everybody here again. What an amazing, outstanding response, and to Maureen for being such a great neighbor to us in South Kingstown and such a great leader. So thank you all.
Would like to thank a few people. I would like to say that without our donors, the unions, which we've talked about, local unions and state feds, anonymous people going on our GoFundMe site and making donations, or going online and ordering things and sending them over to Frank at the Federation of Teachers. I'd like to thank the Wood River Health Center, who couldn't be here today and still has yet to bring their stuff in, for setting up boxes and having their staff and their patients donate. The South Kingstown Women's Huddle, who invited me to speak and made a huge donation and collected items. The Legislative Women's Caucus got together with the help of Senator Valerie Lawson and State Representative Kathleen Fogarty, and made another huge donation. They have sent this entire pallet full of products to us from California to help us out. So Vida is owned by Adrian Forsyth with the help of Mike Wickham, who I was in contact with. Just said, what do you need? What do you want? You know, and quite frankly, I didn't have an answer for him because we didn't know what we need. This is our first year and we didn't know what we wanted. I said, you know what, just fill a truck up and send it to me. So they sent along 19,000 pieces, and we're eternally grateful for that. And so I hope that you can keep up the momentum for a few months and see you next year. And
I just want to say thank you again to Maureen, Frank, Kate, and to everybody who participated. This is really an amazing effort for the first time out of the gate, and we're grateful for the support. These are expensive items. They make a difference to low-income households who are struggling to get by, and we're really pleased and proud to be the recipient and to get these out to people who need them.
Welcome to Labor Vision. My name is Erica Hammond, and I am the Workforce Labor Liaison at the Institute for Labor Studies and Research. Joined with me tonight is Dr. Okurowski of the Occupational and Environmental Health Center of Rhode Island. Thank you for joining us, Doctor.
Nice to be here.
Now, in the past, we really only saw these defibrillators on TV when we were watching, say, a hospital scene or in the event of an accident. And this has changed greatly since then, many years ago. How has this changed?
It really began back in the 1990s, I'd say. State lawmakers, federal lawmakers started to see the potential for significant impact on saving lives by getting portable automated external defibrillators out into the general public. And this really moved the portable devices away from the hospitals out into the public sector. With the advent of new technology and policy changes, we started to see the devices moving out not only into towns, cities, but also organizations, companies. A landmark act came in 2000 with the Federal Cardiac Arrest Survival Act, which expanded federal dollars commitment to getting portable units out into the community. Initially, that was met with some skepticism. There were questions about liability from lay people performing life-saving procedures. But since then, all 50 states have passed what's called Good Samaritan laws to protect individuals who in good faith are trying to help. And that really has also expanded the availability of these devices. You combine that now with better devices, better batteries, and better technology, and we've really seen in the last 5 to 10 years a significant expansion of these devices in schools, communities, and in the private sector, businesses.
I recall seeing them in high school, when I was in high school
Yeah, I
in
mean,
2013.
Yes, they're seen now in most colleges, universities, and the big decision now is for many companies that are looking to adopt this new technology. And there's some initiatives sponsored by OSHA and NIOSH that really support their use in the private sector workplace.
Now, over time, these devices have changed greatly. I imagine they've gotten smaller, more reliable. Can you go into a little bit more detail about those?
Yeah, the initial devices, there were some concerns about reliability, misfiring, errors, but the units really have gotten significantly improved, in large part due to some more federal oversight, FDA oversight. But it's important to remember these are real medical devices that require significant oversight in a program when a company or a municipality wants to bring them into their institution. That being said, both the American Heart Association and a variety of other organizations, American Red Cross, OSHA, actively support implementing AED programs in the workplace to increase survival rates from sudden cardiac death. And what that means is really all workplaces are potential candidates for programs. But when putting in these devices, it's not something that should be done in a vacuum. It really needs to be done with an organized program and significant dialogue between the workforce, management, labor, and also a variety of state agencies, emergency medical services, and we can talk more about that in detail.
Now, what are the important things to consider upon implementation of one of these programs?
That's a good question. It's something that needs some time, and OSHA has actually made some recommendations on this for private sector and municipalities. Key things to consider when you're developing a program is you really need to have some kind of physician oversight, and that can be done through individual physicians, but there's also corporations that provide that oversight. Also, you need to make sure any program is compliant with state, local, and federal regulation. Programs also require some coordination with local emergency medical services, and when you develop a program, you really have to have some component of a quality assurance component to your program, as well as establishing health and safety checks and periodic reviews of a program. So it's not a one-time deal when you create such a program.
Okay. You mentioned previously that workplaces would be a great candidate for having an AED in their facility. What are the necessary steps that a workplace would have to take or should take if implementing an AED program?
So if someone in the workplace is interested in starting a program, the first thing to consider, as we sort of alluded to previously, was the concept of medical oversight. Some states, municipalities require a formal prescription from a physician to start a program. You also want to reach out to local emergency medical services. Often fire departments in local municipalities have resources for individuals or companies, municipalities that want to expand AED programs. You also have to make the decision on choosing an AED. There's multiple manufacturers of these devices. Different manufacturers have different pros and cons and can provide different levels of support. That gets into a key component of any program, is that you really need to have whoever's providing you with the AED also provide you with technical support. These are typically battery driven, so they do need follow-up, regular maintenance. You also need to develop a written program and establish routine maintenance, getting supplies, things like that. There's also issues related to AED placement within your organization. The ideal goal is to have any AED within 3 to 5 minute location to get to any emergency location where something happens. So these do require some planning within the building structure of where they're going to be placed, whether that's in a school or a workplace. The other key thing is you really have to have a training plan or a training program for your employees, workers, and a variety of different organizations have those programs. American Heart and American Red Cross are the big guys that really provide these kind of services. You also have an issue of getting your employees aware of the program and getting buy-in, because without buy-in and employees feeling supported, they won't be used. And lastly, we talked about this further before, it's an iterative process. You have to constantly reevaluate your program, see what's working, test, check equipment, but also check in with your employees. But it's a great opportunity when you put one of these programs in to expand out your health and safety programs within your own company. Many individuals, in conjunction with an AED program, also, it's part of the safety. You get trained in basic life support, first aid, etc. So it can be a complex process, but there's many corporations, companies that have done this. So it's pretty well established how to start out. But those are some of the big things to consider when you're going to implement such a program.
Thank you. Now, what's the effectiveness of these AEDs?
That's a good question. Sudden cardiac arrest survival rates are significantly, dramatically improved in the workplace or any scenario when a defibrillator, an AED, is made available. And OSHA tracks those statistics, and the scope of this discussion really is outside of the specifics. But it's clear that AEDs do save lives and they do increase survival rates dramatically. But it does require a concentrated effort in the workplace from multiple groups. That would include human resources, labor, management, risk, health and safety. And when those groups work together and put in an effective AED program, we do see some pretty dramatic improvements in survival rates.
What's the scope of the issue? And do you have any details of survival rates that you can go into for us?
Yeah, when you consider that sudden cardiac deaths, estimates on sudden cardiac death range from 250,000 to up to 400,000 deaths per year in the United States, and the fact that almost 95% of those die prior to reaching the hospital, the magnitude really becomes clear, because survival rates significantly increase when an AED or any defibrillator is used in the first 5 to 7 minutes of a sudden cardiac death. To specifically tell you the magnitude, estimates are survival rates increase by up to 60% with the use of a defibrillator. And for every minute that somebody goes untreated without a defibrillator who needs one, their chance of survival drops by 10%. So it's a pretty dramatic increase in impact with a defibrillator.
Now, if a workplace implements one of these devices, and they've gone through the necessary training. They have someone there who is trained and able to use one of these devices. In the event that it needs to be used, a worker goes down. Can you just lay out exactly what would happen, what would have to be done, how the device works?
Well, to just give a, going into the absolute specifics is probably, again, beyond the scope of this discussion, but how it would typically work is, let's say hypothetically a worker went down in a sudden cardiac arrest. And let's say 2 workers who had been through the program came upon that worker. What would happen is they'd be, of course, trained in AD use and CPR, and they would, assess the individual, find out that there's no heart rate, no breathing. One would most likely be required to activate the emergency medical response code within the system, and one worker would start CPR, which would include things like chest compressions and breathing, while another worker went and actually got the AD and brought it on site to assist this individual. The purpose of chest compressions and breathing while they're getting the AD is to continue blood to the brain and other vital organs. But once the AED is brought to the scene, it becomes a fairly automated process. The AEDs now are smart devices. They actually walk an individual through the process. Pads are placed. The device actually monitors the individual's rhythm, assesses what's needed, gives a shock if necessary, and actually gives the rescuer prompts on what to do, specifically shock, continue CPR, things like that. This is all done in conjunction with while emergency medical services, formal EMS, paramedics, EMTs arrive at the scene to take over for those individuals that were the initial first responders.
Right. In your opinion, how do the costs of this type of device outweigh the benefits?
I think for a while there was some questions and people were sort of risk averse to putting these programs in, but I think now there's no question that absolutely AEDs outweigh the risks and should be considered in almost all workplaces. The simple fact is AEDs save lives, and they should really be considered by almost every workplace, whether that's at a municipal, state, federal, or private level. The benefits clearly outweigh the risks at this point.
I mean, you laid out the statistics for us. It's so clear.
Yeah, it can be a no-brainer, and we can also briefly talk cost. I mean, the costs have come down dramatically to put these programs in place. We're even seeing personal devices being developed for the individual user. So it's an area where, it's time to see them more in the workplace.
Wow. Well, we're just about out of time. I want to thank you so much again for being here with us, Doctor. Thank you.
Thank you.
All right. Thank you, everyone. You're watching Labor Vision. Have a great night.
Thank you for joining us for this edition of Labor Vision. We appreciate your input and encourage your comments. Labor Vision can be seen on this channel 3 times each week: Tuesday at 7 p.m., Thursday at 8 p.m., and Saturday at 5 p.m.